Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
Oh, that was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Maria Mwacharo.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji, wanakuita wanatambua kama Maria Mwacharo. Unatizama The Sabah Show.
Assalamu alaikum wa rahmatullah. Welcome to the second segment of this program this morning, where we'll be talking about cardiovascular disease. And joining me this morning is one amazing gentleman that you were with last week, and he enlightened you more about the cardiovascular diseases. Because he didn't finish, we had to bring him back and we talk more about this disease. Of course, it is a rising case in this country that does not discriminate age, race, or ethnicity. It cuts across the board. Welcome, my name is Faisal Kasim, standing in for Maria Mwacharo. Dr. Prem, morning.
It's a pleasure.
Karibu sana.
Thank you.
Okay. Dr. Prem,
Yes.
first, how was the camp
Yes.
during the weekend?
Yes, we had
It
a
was on
camp.
Saturday?
Yes.
Yes, how was it?
We had a camp at Avenue Medical Center in Disley. It was a successful camp. It was an opportunity for us to open ourselves to a public which did not have a facility for cardiac, screening. So we had about 19 to 20 patients who had cardiac problem.
Wow.
Of which half of them need further test. 3 of them needed open heart surgery, and rest of them needed further evaluation and test. So
19 to 20
Yes.
had problems,
Yes.
positive. You
Yes.
found them.
Yes.
How many patients in total did you see?
No, that's what 20 total, 19 to 20 total.
Total.
For cardiac problem.
Okay, okay.
Of which half of them needs further evaluation. 3 of them need surgery. So yes, open heart surgery. So we talked to them, and they were very happy. So all the patients which needed further evaluation and further test, we have asked them to come to Karen Hospital, because many of the machineries are so big that we can't take it around, So I told them to come there. And the open heart surgery patients, we had a counseling, we talked to them. In fact, many of them were just shopping around. I was surprised. It so happened that one of the patients had a list of 10 doctors' name, and he's just shopping from one doctor to another. And in fact, 1 or 2 names from outside Kenya also. So I was telling that it is available here, the facility is available. So I think it's a matter of educating them, tell them it is available, the awareness. I think that is what is more important.
As a doctor, what makes you think, how does it get to that stage where you determine that such and such a person needs an open heart surgery, or such a person needs just further evaluation? What makes it necessary for the surgery?
Yeah, when the patient comes to you, you take a good detailed history, examination, and by that itself, you will get to know. What I mean to say is that after certain years of experience, you develop some sort of a sixth sense,
Okay.
Yeah, so you check the patient, take a full detailed history, and evaluate the patient and see what exactly is the problem with him. If you think that the hospital where you are or where you are checking is enough to get all the information, it's well and good. Otherwise, you have to take to a better hospital where we have. Fortunately, Karen Hospital has all the facilities, so we tell them to come there so that we can do what is known as a final diagnosis and the treatment schedule, so that we know which way to go. So I think the important thing is that give a confident, concrete advice for the patient, what to do and what not to do. I think that is what is lacking, because many patients just go shopping, trying to get an answer for the problem. It so happened that I saw one patient who was a 19-year-old boy, what we call in doctor's term called a blue baby. You know, when he exerts, he becomes bluish in color, especially his tongue and lips. So I was told by him and his family is that he had been to many doctors and they told that that's it. You have to take medicine and sit at home. There is no, that's all you can do. But I told him that there is help available. We can do surgery and fix him. But provided we have to do some more tests to find out the pressures inside the heart, the lung, whether he's feasible candidate, because these patients usually come at the age of 4 or 5 and this gentleman is coming at the age of 19. So he has taken a lot of beating. The heart has undergone so many changes. So we have to make sure that he is a fit candidate for surgery so that the results will be good.
You see, Dr. Prem, on the flip side, God bless you for the good work you're doing. There are people who argue that Kenyans and Africans in general, we don't have enough facilities, and that is why, just to act the devil's advocate in this case, those people are patients who have gone shopping to different doctors. There's a person who was diagnosed in this country, and either this country or the neighboring country, I can't remember the details well, and apparently it appeared he was told that he had cockroach in the heart and he had to go for further tests abroad in India. Only to find that there was no cockroach in the heart. Maybe the machine of the x-ray had the cockroach. So maybe just to act the devil's advocate in this case, some people would go for shopping to different doctors and get third and fourth, fifth, even 8th and 10th opinion from various doctors just to confirm.
Yeah, I always believe there's a saying, too many cooks will spoil the dish, you know. So when you keep on shopping with many doctors, each one will put in their own suggestions and their advice. And at the end of the day, they get confused. They don't know which way to go because 10 doctors talk in 10 different ways and they're totally confused. So I think what they need is that basically they have to go to the right person, get a sound advice, and I think the bottom line is that you have to believe the doctor. You know, if you look at him with an element of suspicion, then I think it's a problem. I always find as a surgeon, patients who come with a positive attitude, they always recover faster. And patients come with a negative attitude. What I mean to say is that, you know, many patients come because children want the father or the mother want to have the surgery. He himself doesn't want it. So he is pushed into the hospital, get a surgery done. He doesn't do what we want us to do, like, you know, coughing, breathing, physiotherapy. And at the end of the day, we find that these are the patients who stay in the hospital for a long time and the recovery is very late. So I think the positive attitude is very important because you want to get well, you know. So they do get well.
So
I think
all starts in the mind.
Yes, that plays a very, very important role. I always tell them. So basically, you know, we have a rule telling that the patient has to ask for the treatment, the surgery. Then you give him, he will become okay. If you try to force on him or inject on him, it will never work. You are in trouble.
I'm yet to see those who will come and ask, can I have an open heart surgery?
No, what I meant to say is that you tell him, you know, it's like you lay the facts on the table.
Yes.
And tell him what is
the possible options.
Yes. This is it.
And then
many of them accept. To tell you the truth, that way Kenyans are very smart. They do understand the reality. Tell them this is what is happening and this is what you have to do. They are willing. I don't know whether I am charming them up. I'm not sure about
Maybe. I mean, because you're already charming up the studio this morning. 19 to 20 patients you saw.
Yes.
You said at least half of them needed review and 3 of them needed open heart surgery.
Yes.
What are the popular cases among us? What were the recurring cases?
My practice here in Kenya, about 50 to 60% is rheumatic heart disease surgery. You know, the valve replacement, valve repair. Those are the type of surgeries I'm doing here. About 30%, or I would say 30-40% is bypass surgery, where, you know, there is blockage in the blood vessels because of you know, lifestyle problems, stress, diabetes, hypertension, all sort of complications. And another, I would say 10-20% is congenital heart disease, children born with problem like hole in the heart, you know, things like that. So this is how I split my practice in Kenya at this stage. But I think there is a change in spectrum. For example, last week I did 2 bypass surgeries. You know, long ago, I think if I remember correctly, in 1967, in World Health Organization, there was a paper presented from Kenya telling that African population is immune to heart attacks and blocks in the heart. You know, this was present 1967. But I think it's more of a myth than a reality, because the reality now is that there are patients coming with chest pain, heart attack, you know, problems like that. So I have to do, I think probably in the whole of East Africa, I have done the maximum number of bypass surgeries. I did about 60 in last 2 years, bypass surgery alone. And I do on beating heart, you know, without stopping the heart. So I think there's a change in scenario, there's a change in goalpost, you know. So what people saw about 20, 30 years back is not what they are seeing now, because maybe because of the change in lifestyle, maybe people are not doing much of physical exercise, maybe the food habits have changed, maybe there is more diabetes, hypertension, all sort of things have crept in. So I think altogether it's a change in scenario. So the disease profile has also changed. You know, what you saw about 20, 30 years back is not what you're seeing now. It's all changed. Probably it's a sign of prosperity, I would say. You know, when the kingdom, when the country is prospering, there's a change in food habits,
change in lifestyle,
mobility, people are more stressed. You always drive the car, you don't walk around, you know. And all these new diseases like diabetes, hypertension, all these things are coming in. So I think the whole scenario is changing.
Wow, interesting. Thank you so much, Dr. Prem.
Yes.
Quite shocking, quite eye-opening.
Yes.
I'm amazed, if anything. And this is just but the beginning. We are starting this program. Please don't you go away. We are going for a very short break to go, because when we are back, you just mentioned that 50% traumatic heart surgery, 50%, and 30% lifestyle. Another key thing that he mentioned, he does the open surgery on a beating heart. My goodness. Are you aware, Shakom, if you allow me, just before we go for a break, at least Dr. Prem has done surgery on at least 15,000 patients, or rather, he's done at least 15,000 heart surgeries. 15,000. More about this after the break.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation. On the next episode,
ni wangapi katika viongozi wa Kiislamu ambao wafanya mambo hata mtu kumtoa katika Uislamu wake, wamtoa katika ubinadamu, asiyekuwa Muislamu hawezi kuyafanya. Ni wangapi katika viongozi wa Kiislamu leo raha yao ni wakuchukua wale watu kila ambao ni multazimina na maduata na mashekhe wakubwa wakubwa kwa watu ya gerezani. Raha yao ni kukata shauri mashekhe wale wawe wenye kuuawa, kunyongwa. Na yamefanywa na yafanywa na viongozi wa Kiislamu. Na angalia wengi wanaofanya mambo haya kweli hurudi wakatubia, mara nyingi wallahu la hadith kama dhalimin. Kwa sababu dhulma kitu baya wake, khairi dhulma ile wewe umekosana wewe na Mola wako. Mola ni Ghafur. Lakini dhulma ya kumdhulumu mtu, ukaja ukamweka mahali mtu hafai kuwekwa, ukaja ukamfunga mtu ukamwadhibisha, ukaja ukamuua mtu hakustahiki, bali mtu yule ni muslih na abadilisha watu, wewe angalia alaka yako. Mara nyingi Mwenyezi Mungu atakuacha akikuchukua, akuchukue akhadha azizi muqtadir, huna la kufanya tena, akufanye kwa namna pengine mara nyingine hata usipate kutubia.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Sabah
Thank you so much and welcome to the second segment of the Sabah Show on Healthy Thursday. My name is Faisal Kasim, standing in for Mariam Mocharo, and we are talking about cardiovascular disease. We're talking about awareness. We're talking about what might be the contributing factors. And Dr. just off the cameras during the break, we were talking about the rheumatic heart surgeries.
Yes.
That you said make up at least 50%, and you're telling me some of the causes of this disease.
It's usually caused by the, when you are a small child, if you get repeated infection of the throat by a bacteria called Streptococcus, that can, if it is not
Bacteria?
Bacteria.
Bacteria what?
Bacteria is a bug, it's a small organism.
Okay.
So if it is not properly treated.
The second one you said of the bacteria. Bacteria cross.
Say that again?
Bacteria what?
Streptococcus. It's a name of that.
Streptococcus.
Yes.
Interesting.
Yeah.
Wow. What's that?
It's a small bacteria. It's a small organism.
Okay.
Which causes infection of the throat. And when a child gets repeated throat infection, which is not properly treated, it can eventually get into the blood and affect the heart valves over a period of time. So what happens is that if you get an infection, you may not get the heart problem immediately. It usually manifests in the second or third decade of life, So child may get the infection when 5, 6 or 7 years old, but the problem starts when the patient is 20, 30s. You find that the valve is leaking or the valve has become narrowed, it get damaged. So they come with, dilated heart, breathing problem, all sort of things. Okay. So you have to analyze him and do what has to be done. Sometimes if the valve is leaking, if it can be repaired, sometimes it can be repaired. We can keep the valve what the God has given, so you repair and keep it. Sometimes when it has gone beyond the stage of repair, then you have to take it and put a new artificial valve. That's called replacement.
Interesting. 30% on lifestyle, you say?
Yes. 30% of the patient, my practice is because of the lifestyle problems like increased cholesterol in the blood, getting deposited in the blood vessels, and when the blood vessels become narrow, patient will have chest pain, sometimes heart attack. So they come, we check, and then we do what is known as bypass surgery for that blocked vessels. It's like, if your road is to your house is blocked, you go by a bypass. So we put a new channel, new conduit, you can say, to supply that part of the muscle. So it's because of the lifestyle problem. Excessive fat and cholesterol and all sort of things in the blood causing deposition on the blood vessels.
As my producer is preparing to bring you some of the images when Dr. is at work.
Yes.
You mentioned about lifestyle, you mentioned about excessive fats and overweight.
Yes, it's a very important factor.
How does it come in?
I don't know whether you remember when President Obama was the president of the United States, he made a point. Just like smoking is injurious to health, he told that obesity is injurious to health. Obesity, so overweight is always injurious, because when you have overweight, it brings in you are more likely to have blood pressure problem, hypertension, more likely to have diabetes, more likely to have joint problems. Yes, overweight. Then more likely to have heart problems.
So how is it likely to affect your health, your heart health?
Yes, because obesity, that means you have got a lot of fat running around in the blood, and these get deposited on the blood vessels, and over a period of time it get blocked, and then you get multiple problems like heart attack, chest pain, and it limits your capacity. So I think controlling your weight is a very important thing. That's why we push a lot on the lifestyle thing of it.
Diabetes, you mentioned about diabetes and hypertension as well.
Yes.
Of course, so how do they affect your health?
See, these are all risk factors. Diabetes as well as hypertension, both are risk factors in a cardiac problem. Because if you ask me one reason for a heart problem, there is no one reason. It is multiple reasons. So it's the risk factors which causes the problem. So if you can avoid the risk factors, you can avoid the cardiac problem. You understand what I'm going to say? So the risk factors could be smoking, drinking, having diabetes, hypertension, stress, then of course family history. All these are risk factors. So you keep on adding, 2 plus 2 is 4, 4 plus 2 is 6, like that it keeps going. So if you can take out the risk factors one after another, the chance of getting a heart attack or heart problem is much less. That's what I want to tell you. So if someone has got a diabetes, get it treated. If you have a hypertension, get it treated. So that is why we stress on the factor that you should have a yearly health checkup, wellness program, because as you know, prevention is better than cure. So I always tell that if you are more than 45, better to have a check every year, just to make sure that things are fine, because if there is anything, we can always fix it.
And your cardiac health.
Yes.
Doctor, this...
Yeah, this is a model of the heart. Just wanted to tell you, just an anatomy. As you know, God has created, everyone has a heart, it's on the left side. But sometimes, the position of the heart can change, There are people with right-sided heart, so that's called dextrocardia. It's not a crime.
What are the chances of someone having his heart on the right?
Right side. Sometimes it can be in the middle. Yeah. So usually it is on the left side. Oh, sorry. It's usually on the left side. So sometimes it can be on the right side like this. Sometimes it can be in the center. So these are all, I would say, anatomical variations by which the God has created you. But having that is not a crime. There are many people walking around with a right-sided heart. There is no problem at all. Wow. Yeah, but
and the body just functioning
normally. Normal. So it's like, so you find that he has got a problem. When he comes to a doctor for some other problem, you check and find, oh, your heart is on the right side, But I have done a couple of surgeries on a patient who is having a problem in the right-sided heart. It's a little tricky, and I have published in the journal also. Okay. So it's a rare thing, but I've done one or two few cases. Yeah.
Diabetes, how is it likely to affect the cardiac health? I mean, if you can just illustrate to us.
So what happens is that, heart is a muscle. Basically, like any other organ in our body, heart also needs blood, food. And the food comes through the blood vessels. So the heart is supplied by the blood vessels known as coronary arteries,
Coronary,
yeah. These are the ones which supplies the muscles of the heart. And we have two, one on the left side, one on the right side. So the left one is called left coronary artery. The right one is called right coronary artery. It's very simple. The left one supplies the left side of the heart, right one supplies the right side of the heart, So it arises from the main, at the base of the main blood vessel called aorta. It takes the oxygenated blood throughout the body, So even though the function of the heart is to pump, blood, it cannot take blood from there. He has to get, just like, you are like for example, I always tell that heart is like the teller in the bank. You must have gone to a bank and there's a teller sitting in a glass cage.
Yes.
So his job is to receive money and give money. But that does not mean that he can take some money and go home. No. To maintain his family and himself, he should get his own salary. It's very simple as that. So heart is like that. He's sitting in a cage in the chest, just like the teller. And even though his job is to pump the blood, for his maintenance, he needs blood by himself. And that comes through these coronary arteries, which is arising at the root of this aorta. Now what happens is that when there is a lot of fat and fatty, cholesterol and all those, it get deposited. Mind you, these vessels are small. It's about 2 to 3 millimeter size, So you're talking about a very small size of the blood vessel. So when it get deposited, initially you may not know it. Because think of a road. A little bit of blockage you won't know, somehow you manage. But when the blockage becomes more and more, then you feel that traffic jam, Like that, when it deposits more and more, it starts to manifest. And the manifestation is usually, like patient is telling, when I climb the stairs, I get some chest discomfort, I get sometimes chest pain, and when I take a rest, it goes off. That's a typical thing they say. Or sometimes when you climb the stairs or going fast, I get breathlessness, I have to go slow down.
Yes.
So these are the pant a lot. So these are the usual symptoms they say. So exertional dyspnea we call it, that is breathlessness or exertional chest pain, And especially is very typical. You say I run after matatu or climb the stairs, I get the problem. When I'm sitting at home, I have no problem. So that's a very telltale sign,
Yeah, exactly, Doctor. Just before we go to this very short break, can those be considered as signs as well for persons suffering from hypertension that they might be developing cardiac disease?
Yes, because when hypertension is nothing but the pressure exerted by the blood on the side of the blood vessels. You have it, I have it, everyone has it. Now it can alter physiologically because as you become old, pressure slowly becomes high because the blood vessels, the blood vessels undergo some changes. A pressure in a normal blood pressure of a man of 70 and a normal blood pressure of a man of 30 will be slightly different. That's physiological, but it can go up. So that is known as hypertension. When it goes up more than the estimated or accepted level, then you say, all right, this guy has got some problem. He has got some blood pressure problem.
Wow.
So you have to check him not once, multiple times, just to make sure that his pressures are always elevated, even when he is sitting and relaxing. You know, there is something called a white coat syndrome. You go to a doctor's place, suddenly your pressure goes up, your heart will race, especially when the doctor is a stranger to you.
Phobia?
Yeah, so you can say that phobia. So that's called the white coat syndrome. It's known all over the world.
Wow.
So you have to, so the doctor has to make you comfortable, tell that, look, everything is fine.
Relax.
So you just relax.
Everything is okay?
Yeah.
Exactly. Thanks so much, Doctor. We are having a few questions that we're going to look at after the break. One is asking, what are the common misconceptions about heart diseases? Other is asking, what is a stroke? And there's a story attached to this, by the way. He says, once I had a friend who collapsed, and I, with the little knowledge that I had to check the heartbeat, I did. I couldn't feel it. But because I was not a professional, I couldn't help him. And he died in the ambulance. It could have been something else, but I have to encounter such a case. How can I help a friend next time?
Sure.
And then another question that comes is, how do you exercise the heart? These are some of the questions that are streaming in. You can now call when you're coming back for this third segment. Take up your phone and remember to make a call, follow us on social media, drop in your comment, and Dr. Prem is inside the studio to answer your questions. All this and much more after the break.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Wake up to exciting mornings every day. Active Jumatatu with Muhammad Obura. Tech Tuesday with Yusuf Farah. Wednesday, the special edition Business Chat with Ibtisam Jamal. All about your health on Healthy Thursdays with Mariam Mwacharo. Aisha Khan with thorny pertinent issues every Friday on the Round Table. Fresh discussions, direct probes in Sabah Show, only on Horizon TV.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Thank you so much. Welcome back to the third and unfortunately the last segment of our show this morning. Dr.
Yes.
Tell us about exercising the heart. How do you exercise the heart?
Yeah. You don't have to do the exercise to the heart, but you have to exercise your body. That's what I want to tell you.
So you exercise your body, your heart automatically becomes fit.
You know, it's an organ. As you know, heart is an organ which starts functioning when you are born, and it keeps running till you are dead.
Okay.
So you don't have to give an exercise for the heart as such, but you can give exercise to the body.
To your body.
Yes.
And the heart will be okay.
Yes.
Okay. Let's talk about stroke.
Yes.
Someone asked about a stroke. What is a stroke, and if you can explain it in relation to cardiac condition?
You can get stroke in two ways. You know, basically the blood supply to the brain, either it can get blocked or there can be a bleed. You know, when the pressures are high, for example, suppose someone has got a very high blood pressure, he is not treating, he is just walking around. Sometimes when the pressures are high, small blood vessels inside the brain can break. Sometimes inside the nose can break. I don't know whether you have heard, some people are bleeding a lot from the nose because of the high blood pressure.
Okay.
So some of these small blood vessels can, you know, just burst because of high blood pressure. And if that can cause a bleeding inside the brain, it can cause a stroke. So also, when the blood vessels get blocked, just like I was telling you about, the road getting blocked,
Yeah.
the blood supply to the brain becomes insufficient, and that can also cause a stroke.
In relation to cardiac.
Yes, that's what I mean to say. So the lifestyle, when there is a lot of cholesterol or fatty acid or whatever it is in the blood, they can go deposited not only in the heart but also other part of the organ. So that is, it is mandatory for any heart specialist. When a patient come with heart problem, it is mandatory that he should check other parts also. For example, his brain, his legs, because it can get deposited anywhere in the body. It's not that it's going only to the heart. So you should ask leading questions to the patient, asking that whether when he walks around, did he get giddiness? Does he have any blackouts? Some people suddenly jump out of the bed, they feel that I feel dizzy, all sort of things. Or when you walk for a long time, do you feel pain in the legs? Sometimes they complain of muscle cramps. So all sort of leading questions you have to ask. So it's mandatory as a cardiac specialist that when patient come with a heart problem, we have to look at the other organs also, especially the legs and the brain. So what we do, what is known as a carotid Doppler. As you know, there are two arteries in the neck which goes up, which supplies the blood supply. So we do what is known as scanning of the arteries to make sure that he is fine. Suppose if he has got a history of a stroke, we take CT scan of the brain to make sure things are fine.
Is there a first aid to a cardiac arrest?
It is. So that is what I want to tell the public. If suppose someone near and dear at your house having a chest pain or a discomfort, chest discomfort, let's say, in the middle of the night, where no help is available immediately, you should not get panic. What you have to do is loosen his dress, open the windows, let the room become more airy. Don't crowd around the patient. Many times what happens, all the family members will be crowding around him, and
because they're worried, they're
yes,
panicking.
So in the bargain, the patient get panicked, and when you are panicked, your heart rate is increasing. When the heart rate is increasing, it needs more nutrition, no more food. So you are triggering a mechanism by which it is becoming more and more.
And demanding a lot.
Exactly. So what you have to do is basically make him cool and comfortable. So don't crowd around the patient, don't make him stress, don't allow him to smoke, don't allow him to watch TV, tell him to just relax, make him comfortable in the bed, loosen his shirt or whatever it is,
Cloth.
Open the windows, and if you have some medicine at home, especially aspirin or some, give it to him. Then you take the phone, call for the hospital, for the ambulance. That's the first aid you have to do, because don't make him panic. That's number one rule. The more he becomes panic, more is the heart rate, more is the problem.
Wow. Interesting, Dr.
Yeah. And the pain, what I want to tell you one more thing is that the pain will be usually, it's on the left side, and it can sometimes radiate to the left hand, sometimes it can to the back, sometimes it can radiate to the neck and even to the tooth. There have been instances where patient had tooth pain and went to a dentist, and dentist has taken out the tooth, but the problem is in the heart.
Are there any specific positions that he should be lying, or he should
No,
be
he can lie on his
leaning,
back.
or just lie on his back?
Yeah, just lie
I'll
on
be
his
safe
back.
that way.
Yeah, that's no problem.
Interesting.
Yeah.
What are some of the common misconceptions related to heart diseases?
The major misconception is probably because there is no awareness. If the awareness is better, I think things can be much easier.
So what are some of those misconceptions?
Yeah, misconception is that, one thing is that, like I told you, patient going shopping around, trying to get a good
opinions.
Yes, more opinions, trying to shop around and trying to get a real definite answer. So probably awareness to the patient and the family or the whole public through the media, through the paper, or through having camps, so that they know if there is a problem, there is help available. And that is why we are trying to push it more and more. As you know, that Karen Hospital has got a charity arm. It's called Heart to Heart Foundation, by which we raise money and try to do charity, especially for children below the age of 18.
Yes.
For that, we have what is known as yearly we have a heart run program. Last time it was very successful. About 25,000 children came for the heart run. Then we have what is known as annual dinner, which is due next month on 29th.
Doing an annual dinner next month.
Yes. So by which people donate money, we have a dinner, and that money is being used to treat people, people, underprivileged people who doesn't have the money. So basically the motto is that to help the people, even if you don't have money, we are trying to help them out so that they don't have to go door to door trying to get help.
Interesting. Dr. One individual,
Yes.
15,000 successful heart surgeries. What's the secret?
I don't know, maybe, you know, it is a passion towards the job. Maybe you wanted to help the poor, underprivileged people. Probably that is what is driving me, so that, you know, you part your knowledge, part your wisdom to other people, try to help as much as you can, so that.
At any chance, at any given time when you're holding those clips and the scissors, are you scared that something can...
I'm never scared. Probably that's the easiest thing I do. You know, a worried cardiac surgeon or a, you know, is the worst thing you can think of. Cardiac surgeon, if you are a qualified cardiac surgeon, you are not scared. Probably that's the easiest thing I do. I always tell, the easiest thing is to do a surgery. Because, because you know, probably because I've been doing it for quite some time, I know what to do. And sometimes, you know, some complicated cases, you do have to work hard, or you have to put in all your effort. But, you know, as the saying goes, you have no, as a cardiac surgeon, I have no right to give life or take life. I am here to do the duty, and you have to do the duty.
What's the most difficult one or the most challenging one you've ever faced, and how was it?
You know, every case is challenging, you know, because people say that a hole in the heart, but each one is different. For example, rheumatic heart disease, each one is different because each one is challenging. But you do get sometimes challenging cases. Suppose, you know, a lot of reference from other hospitals, sick patients will come where the heart is not beating properly, patient is on multiple supporting medicines. You have to do the surgery, you know, it's like a 50-50 chance, but you still go on because you take, I think the main issue is that you have to tell the patient family, you know, tell the truth. Tell that this is what is happening.
Okay.
These are the options.
Thanks so much. Dr. I'm told there is a call. Horizon TV, hello.
Hello, my name is Bridget.
Hello, Horizon TV?
Yes, my name is Bridget.
Yes, karibu sana.
Thank you. I was wondering, Dr. Craig.
Yes.
I wanted to find out if persistent coughing and chest pain and also got an indication of a heart complication.
Bridget, please switch off the TV or just reduce the volume of your TV so that we can get you clearly, if you don't mind.
Okay, my question is,
Okay.
is persistent chest pain and coughing
Persistent chest and
also
coughing.
attributed? Persistent coughing and chest pains attributed to heart diseases too.
Okay. Thanks so much, Bridget.
Okay, thank you.
Dr. Persistent chest pain and coughing.
Yeah. No, the best thing is, as a doctor, I have to ask few questions to her.
Yeah.
Like whether she coughs, some phlegm is coming out, or is it a dry cough? And chest pain, is it confined to the left side? And I was telling it whether it's coming to the hand or go to the back. How old is he? Does she have any risk factors like diabetes, hypertension, family history? You know. So,
so he should reach you.
Yes,
he should reach you for more consultation.
Yes, because I want to know so many things, you know, so that we can pinpoint. You know, cough and chest pain is a very broad thing, as you know.
But are there chances that chest pains and coughing might
maybe
maybe
you know, there are two options. As you know, we have got heart and two lungs.
Yeah.
Even though they are two organs, they function as physiologically as one organ. You know, they are interconnected in many ways. So sometimes if there is a lung infection, that also can cause this problem. You know, cough and chest pain. So I would like to ask her more questions, check her, and see and narrow it down. What exactly is the problem?
Current hospital.
Yes.
Dr. Prem.
Yes. Anytime.
Before you cut you, Dr. Prem, maybe you tell us. Before I cut you, you're telling us about the most challenging heart surgery you've ever done.
Yes.
And you said they're all challenging. The only thing you need to do is just to tell the truth.
Yes. Tell the truth and put your heart and mind 100% or even 110% to whatever you do.
The truth will set you free.
Yes. Because I always believe, more than the family wanted the patient to go, I want every patient to go home. You know, I'm much more concerned than the family. So I put my heart and mind, 100, not 100, I would say 110%, do what you can do, and then pray to God. Because as I told you, I have no right to give life or take life. I'm here to do the duty, and I'll do with complete honesty.
Diligently. Hats off, Dr.
Thank you.
Hats off.
Thank you.
Hats off. Thank you so much.
Pleasure.
My goodness.
Good.
My goodness. Yes, guys, that was Dr. Prem from the Karen Hospital. I got to learn quite a lot this morning on heart diseases. And I'm sure you have done so as well. Few things that he mentioned that are quite important. One is that you need a regular checkup. So for all those who are watching this morning, please just make a point and visit Dr. Prem at the Karen Hospital and get yourself checked up. As I was doing Horizon TV, hello.
Hi, how are you?
Horizon TV, hello.
Hi.
Hi, how are you?
I'm fine, thank you. How are you?
Yeah, salama sana. So maybe tell us your name and where you're calling us from.
My name is, I'm calling from Nairobi.
You're calling from?
Nairobi.
Karibu sana, Mary. Just reduce the volume of your TV so that we can get you clearly, please, Mary.
Sorry?
Just reduce the volume of your TV so that we can get you clearly. Tafadhali.
Okay.
Okay.
You can hear me now?
Yes, Mary.
Okay, so I wanted to ask the doctor, I've been panting a lot, like the simplest doctor. So walking from here, like a 5-minute walk, and doing the stairs, doing my chores. I wanted to know, could that be an indicator of a heart issue?
Okay.
Yeah.
So she's panting a lot when she does.
Yeah, she's panting a lot every time she does very minimal activities. Basically makes her.
How old is she?
Panting a lot.
So what I mean to say once again, that's not a good sign.
Mary from Nairobi.
Yeah, what I mean to say, for Mary, even doing a minimal things, something very simple at home.
Like just going up the stairs.
Yeah, I think it looks like the way it looks, not even walking, not even going up the stairs.
Yes.
She's having breathing problem. So I think it's not a good sign. It has to be evaluated. Once again, I would like to ask a few things like, does she have any risk factors? What is her weight? Does she have any obesity?
Any historical medical
diabetes,
conditions?
hypertension? Does she have any chest pain?
Okay.
All sort of things, So I think she should get checked.
She should get checked.
Yeah.
And she'll find you at the Karen Hospital.
Yes.
Thank you. Dr.
Yes.
Just give us your closing remarks, because when I was just concluding the show, another call came in.
I see.
So try your luck.
Yes. Yeah. So my take-home message for the public is that there is help available. So don't get shy. It's if you have a problem, come get checked. As everyone knows, prevention is better than cure. So if you can catch it very early, you can treat it, and before you get into complication. So a wellness check is important. Any person more than 45 should have a yearly checkup. So
more than 45?
Yes.
So I'm safe?
Yes.
Thank you. Alhamdulillah.
Yeah. So if there is a problem, you treat it. Otherwise, you can go home happily and have a comfortable life.
Thank you. Sante sana.
Yeah.
Thanks so much, Dr.
Thank
Pram.
you. Pleasure.
Thanks, sana. Thanks so much for making time to be here.
Pleasure.
Thanks so much for your knowledge and enlightenment.
Thank you.
Thanks so much.
Thank you.
Yes, guys, that was Dr. Prem, and I won't take much because Shakombo is seriously on my neck. Mohammed Shakombo, that's my producer and director this morning, is seriously on my neck that we have to wrap it up and call it a show. Thank you so much for keeping me company for the past 2 hours. I've been your host, Faisal Kasim, and Mara Mocharo, get well soon, man. We miss you in this set. Assalamu alaikum wa rahmatullah. Remember, tomorrow, live real talk. Tonight, tomorrow night, live real talk. Assalamu alaikum.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.